This is Dr. Charles Parker, and you're listening to Core Brain Journal. It's a place where I connect both fresh discoveries and interesting different perspectives from advanced mind science with the realities of real people and everyday life down on Main Street. Well, welcome aboard, folks. Dr. Charles Parker here one more time, and today we're going to talk with a gentleman, a physician out in Iowa, Dr. David Steenblock. Welcome, David. Thank you for coming on board. We appreciate it.
Hi, Chuck. I'm from Iowa. I now live and practice in California.
Oh, you do? I'm sorry about that. I was looking at the Iowa references.
Yeah, well, it's hard to get out of Iowa, but I finally did. I finally made it out here to California, the land of sunshine and forest fires right now, or fires we have going on. So, it's a great state, though.
We're going to find out more about exactly where you are before we get over, but I want to introduce you in just a moment. But I'm going to just, as a teaser right now, tell everybody that we're so interested in talking to Dr. Steenblock. He is interested in stem cells, HBOT, which we'll talk more about in a moment, mainly personalized regenerative medicine. And we're going to be talking very specifically about what can be done about Alzheimer's and ALS. We're going to jump right into that in just a moment. Before we get started, let's talk a little bit about our sponsors. And you listeners already know how much we love the reality of hard data here at CBJ. And today we welcome our clinical friend and new partner, Direct Health Access Laboratories, with over 3 million studies. They are deep leaders of experience with the big picture of measuring, for example, methylation, cryptopyrrole, and copper challenges. They provide a global service with a molecular focus. Stay tuned and run over to dhalab.com/core for more information. And our other sponsor is really dedicated to detailed improvements of mind care on a treatment level. Today, we're pleased to welcome the other sponsor and partner with a deep interest in fresh options to address the complexity of, get this, adolescent treatment failure nationally and internationally. Why do we say internationally? Because they are so involved with TRICARE, and there's so many TRICARE participants which actually use their services. For 80 years, the nonprofit Barry Robinson Center teams in Norfolk, Virginia, have provided residential care on an evolved family, interpersonal, and I'm going to tell you personally, they live right down here near where we are, on a comprehensive level. They're doing all kinds of fresh ideas with adolescent residential care. Do drop in over at Barry Robinson, BARRY, Robinson.org/core for more information over there. So now let me introduce you to David Steenblock. He is an osteopathic physician. He was born in Iowa and has 4 children, 1 grandchild. He's been practicing medicine for over 40 years and is currently medical director of the David Steenblock DO Incorporated Personalized Regenerative Medicine Clinic. And he does a lot of research there as well with a 501 nonprofit organization. Beginning in 1989, Dr. Steenblock was one of the first practicing physicians to employ, get this folks, it's been an interest of mine for many years, hyperbaric oxygen therapy to treat stroke, and was one of the very first to use HBOT to treat an acute stroke case, which produced a remarkable clinical response and turnaround. In 2002, he started working closely with highly credentialed physicians in Mexico who treat patients with pure cord blood stem cells in conjunction with protocols he developed out there. And in 2004, he helped spearhead a pilot study involving 8 children with cerebral palsy. They were treated in Mexico with cord blood stem cells. We want to talk more about that. It's considered edgy in the United States, but if it's working, we should be talking about it. And he's co-authored the very first lay-level books on umbilical cord stem cell therapy ever published, called Umbilical Cord Stem Cell Therapy, The Gift of Healing from Healthy Newborns. And we're going to be talking more about that as well. So during the 1990s, Dr. Steenblock began specializing in the repair and regeneration of damaged brain tissues in people with chronic stroke, traumatic brain injury, cerebral palsy, and autism by the use of hyperbaric oxygen treatments. So let's go on and talk about what is hyperbaric oxygen treatment in the first place. And I want to know on a personal level, I'm just going to ask you to amplify on this when you start, is the type of chamber that you're using, so we could also talk about that. So if you tell us, first of all, I'm getting the cart before the horse because I'm so interested. Tell us about how you got interested in the first place, then we'll talk about the technique and the equipment.
Got interested in hyperbaric, in regeneration, and stem cells. You put a big question out there. Yeah. I started in Iowa
yeah.
in about 1948. And I did my first autopsy. Can you believe it?
48.
Yeah, and when I was 4 years of age.
Yeah. Ouch. Was your father a physician or something?
No, but he was a farmer, and we had a horse die, and the vet came over and was going to do an autopsy, and I insisted that I got to help. And
good for you.
Everybody tried to drag me away, say, no, it's not proper for a 4-year-old. I said, get out of my life. I'm doing this. And that's how it began. And so
interesting.
I've been interested in medicine and aging and how that whole thing works since then. And so I've spent my whole life basically becoming a doctor and learning as much as I can possibly to help myself and help you. So we're all in this together. The only way out of here is to die. And I'm trying to keep you from dying and keep me from dying. So that's my story, and I'm sticking to it. So how I do it is by learning everything I possibly can and figuring out all your little problems, because there's a big difference in doctors around the world and how they believe, and including aging people. Aging, I had a PhD fellowship once, and they gave that to me at the University of Miami, and to study aging. I got there, and they didn't want to hear about pathology. And pathology, of course, is disease. And I thought that pathology and disease went right hand in hand with aging, and these aging doctors didn't believe that. They thought you age and pathology had nothing to do with that. I said, well, that's not the way it works, and I don't agree with that. So I left and went back to medical school, because I think pathology is intricately involved with the aging process. Yeah. And if you start thinking about it, how and why that works is because of the telomeres. And telomeres, of course, are the ends of the chromosomes that replicate, and only replicate about 52 times before they stop working, and your cells stop working, and you stop being able to repair yourself. So if you don't have cells that can repair, you can't repair, and you can't regenerate, you can't keep alive. And so anything we can do to keep those telomeres long and keep those cells replicating in a normal fashion, you can repair yourself even at a old age. But when your telomeres get short because of oxidative stress, wear and tear, infections, heavy metals, and all these kinds of things, your telomeres get short. You can't replicate, you can't repair, and you cannot live long. And so you die early because of that. You know that because if you look at back in 200 or 500 years ago, the average lifespan was like 29 years, right? Because of the fact we had no vaccines, we didn't have good clean foods, nobody had anything, so we were just out there like wild animals, basically. In those kind of situations, the human population generally lived to only till 29. Now, what caused them to die? Infections. And so infections kill them then, and they'll kill us all, because the infections cause a certain change in the white blood cells, especially. Now, people don't realize this, but when you eat, for example, meat, your white blood cell count in your blood, if you measure it, runs about 8 to 9, 10,000, right? But if you switch over to a vegetarian diet, it drops down to 4,000. Now that's a big difference. That's half. Now why is that important? Because white blood cells have enzymes that degrade your entire body. And so the more white blood cells you have in your body from infections, get it? The infections cause these white blood cells to rise up in number, and these enzymes in the white blood cells are called matrix metalloproteinases. They digest all your extracellular matrix and the blood vessels and whatnot in your whole system, and so you start to age quicker and faster. That's why you get wrinkles and all these things that go along with the aging process, because of these infections. You know, the people that have smoke and have chronic infections, they look bad, right? Because their skin becomes sunken, and they get more wrinkles, and the color is not so good. It's all because of this degradation of the extracellular matrix, which is because of these white blood cells. So anything you can do to keep infections from your body and stay healthy, basically by keeping infections out of your body and avoiding having infections no matter what, and keeping those white blood cells low, you're going to stay alive and live a long, long time as compared to having chronic infections one after another. Old people, the ones that live the longest, over 100 years of age, they've done studies on those, and you know what they found? They found that the reason they lived a long time was the absence of risk factors, the absence of infections. They never were sick a day in their life, you see? And that's what causes a person to live a long time. Never get sick. That's what causes you to live long. So you don't want to get sick. And if you do get sick, you want to get it treated right away. And you don't want to keep festering and say, oh, I'm not going to go to the doctor, it'll go away and all that. Because all of those things take its toll. They take their toll on your system. Because if you have an infection in your lungs, for example, the lung tissue is being oxidized and damaged by the infection. And that causes those telomeres to get shorter. And the cells in that tissue then they have replicated trying to repair, and they don't have any replication anymore after a while. So your lung tissue can't repair. And when you get to be 60 or 70, that's why you get emphysema then, because you've already taken away all the reserve capacity of those tissues because you've been damaging it with infections and the smoking and all that. So you wind up with no cells that can repair. So nowadays we have some real new exciting things to talk about. And I'm just jumping off into this stuff because it's so interesting to me. And that's this thing called senolytic therapies. Senolytic, S-E-N-O-L-Y-T-I-C. Senolytic therapies is a way to take out these old cells out of your body and remove them. And when you do that, that frees up all your tissues that are now congested with all these old cells that are no longer working, and they're just festering and they're causing you inflammation. And in fact, they're just irritating your tissues and making you ache and sick and not have energy and all that. You get rid of those, and now your bone marrow stem cells can replicate and go in there and fix those and fill those in, and now you have new cells that are coming from your bone marrow. So you're having a really rejuvenative effect by just getting rid of these old cells. So that's a new technique that we're just now starting to explore. I just started to treat people with this new kinds of therapy, and we can give it orally. One of the things that works right now that anybody can do is quercetin, which is a bioflavonoid. You take like 2 grams 3 times a day, and gamma tocotrienol, and you take 100 milligrams 3 times a day. And you do that, and that helps take away these old cells. So that's a real trick that can help you right now start getting younger right now without really too much time or trouble. Okay, so that's an exciting now. You can also take out those old cells and put in new stem cells. So if you have, so let's say you're 65, 70 years of age and you want to get younger, what you can do is do this, take out these old cells, and then you can do a treatment where it's called a Neupogen or filgrastim, which is a granulocyte colony stimulating factor, which is a drug that we use. It's not a drug, it's a natural hormone substance or cytokine that the body uses to mobilize stem cells from your bone marrow. And so if you take that daily for 5 days, what happens that the stem cells from your bone marrow are flooded, they come out and flood your system, and they'll go into those cells, those areas where we have taken out those old cells, and repair and replace. Okay, now if you wait for 2 weeks, 3 weeks, and do it again, what happens is that the bone marrow that you just put out into the circulation, there's a new crop of bone marrow stem cells that you have just induced to grow. And these new stem cells that you've just induced to grow by this 5-day course of Neupogen, now 2 weeks, 3 weeks later, you've got 5 to 10 times more stem cells in your bone marrow than you had to start with. So, and these cells are like virgins. So here at 70 years of age, you can have a whole new set of genetically perfect or close to perfect stem cells throughout your body by just doing this little technique. And so that's a really exciting new way of doing it. Now, in general, to do it really well, you have to do a bone marrow. You take out the bone marrow with a needle and take it out and put it back into the blood, so you get all these brand new, fresh, virgin stem cells out of your bone marrow, because they have a hard time coming out. But if you do that, you get some really great results. Even with Parkinson's, Alzheimer's, all kinds of diseases, you get some great results with just this simple technique of taking Neupogen first and then waiting 2 weeks and then doing the bone marrow.
Could you spell that word, because I'm unfamiliar with it?
Yeah, Neupogen is spelled Neupogen. Neupogen.
Yeah, good.
Or GCS FG. CSF, granulocyte colony stimulating factor, is what it's called. And it's a typical product that they
That's
use
interesting.
for cancer. And they use it for
Interesting.
cancer to stimulate the bone marrow to make stem cells appear in the bone marrow from the bone marrow into the blood. And they, after 5 days, on the 5th day, they do what's called a leukapheresis, and they take the blood, take and remove the white blood cells, collect these cells, and they then freeze them, and so then they give you cancer chemotherapy and whatnot, and then they take a few weeks later, they come and get it out of the freezer and give you back your own stem cells that you made by this process. Well, that's good, but for you and me who don't have cancer, it's a way with this technique of doing 5 days of this Neupogen and then wait for 2 weeks. The body's bone marrow will have replicated many times in that 2-week period, and you have these cells that were not operating, and they were at the bottom of the bone marrow. So there's, in the bone marrow, you have 2 layers: a superficial, which is what you're using right now. You and I are living off of these red cells and white cells that are being manufactured from the superficial layer in the bone marrow. But underneath that, in the basement, you have cells down there. I call them virgins. They're in the basement hiding out, and so they're not getting oxygen. They're not getting much blood supply at all. They're like little seeds just in there perfectly waiting for you to say, I need you now. And so now you can go in there and get those perfect cells and bring them out and put them into your system. And those are much more vital than the ones that you have here on the surface that are now just normally working. And they've been working now for 70-some years. And so they're getting a little tired of it all. And
Well,
so,
that is so interesting, David. Now,
yeah,
let me run the tape back for just a second,
sure.
because you said so many interesting things there. And I know it ran by me and I was listening carefully, but you were talking about those old cells, and something I didn't quite get from you. It sounds like implicit in your remarks was the fact that the old cells somehow predispose a person to not being able to recover in some way. They actually do something negative
That's right.
to the evolution. And you said something quickly about that. How does all that work?
Well, they don't work is the problem. And so as the cells, the normal cell has about 52 replications before it stops replicating, okay? It cannot multiply again. It just runs out of gas, and the reason for that is these telomeres get shorter and shorter, and they control this rate of replication.
I got
So
you.
when you run out of those 52 replications, because your body is replicating because of damage, your lung is being damaged by the smoking and the infections, and so it has to replicate to repair. So it has to make new cells to repair the ones that are dead or dying and damaged from all this stress that is being put on the tissue. So
Gotcha.
after 50, about around, really it starts about 40 replications, the cells start to slow down and no longer function. By the time you get to about 50, 52, they stop working altogether, but they don't die. They just become like I always make a joke about my grandfather. A great guy, but when he was older, he got the couch potato syndrome, and he sat on the couch and wouldn't move. And he'd sit and watch these cowboy westerns that we used to have when we were kids. Remember those?
Oh, yeah.
Hopalong Cassidy and all that, Roy Rogers, and here he'd be sitting there, and I couldn't get him off the sofa, and he wouldn't move, he wouldn't do anything, and he just would, mess up everything. So that's what we have: old cells not wanting to do anything. They're just sitting in there messing up, and so they're not good for anything, and they're just taking up space. And so if you have half of your liver are senescent cells, that means half your liver is not working. So if you can get rid of those and let new cells come in there, then you have now return of function. So you have a lot more function that you have when you're young.
So they dissolve those old cells. They actually go in and break them up in some way?
Well, yeah, that's what I was talking about, the senolytic therapy. That's what this is all about.
That's what it is. Okay, I got you.
The quercetin and the gamma-tocotrienol is something I can tell everybody to do right now. I'm using things in the office that are much more aggressive in terms of removing that, because you come in from wherever you come in from, and I want to give you the best shot of youngering as I can. I have a whole program called youngering, where you come in for 1 day, 2 days, 3 days, 4 days, and I put you through therapies, IV therapies and whatnot, that take out these old cells, and then I pump in new cells, brand new umbilical cord stem cells, so you get really quite a youngering effect. It's really amazing what you can get with this kind of therapy.
That is
now.
terribly interesting. I mean, the application there is very interesting. So what you're talking about right now is one aspect of it, which is the regeneration and aging issue. And we started there, and that's where we are right now,
Right.
Justifiably. But it was interesting because you were also talking about things beyond the aging process, and in the notes that we were reading here in your CV. And
Well, we're talking, I specialize a lot in neurological cases because I've been doing neurological now since about 1990, 91. And so for the 1990s, I specialized in brain injuries. And so I, treated thousands of patients, and mostly with hyperbaric and growth factors and things like that. So I've got a lot of experience with neurological cases. And then from 2001 on, I started expanding it into the stem cell arena, and we started doing stem cells, and we've been doing umbilical cord and bone marrow and fat stem cells since then. I've done now over 7,000 cases, and just briefly, you mentioned cerebral palsy. I can tell you for a fact, cerebral palsy, there's no other treatment that is as good as stem cells for cerebral palsy. I don't know why. I do not understand why it has not taken hold, and the government has and the insurance companies have not started to pay for it, because it is marvelous. It is a miracle for cerebral palsy. It's just, I can't speak enough about it. I've treated thousands of these cases, and I would say there's a good 80% of all the patients have good to great results. Okay. Now, and these are people that are, I have had 5 children totally blind have gained their sight. Never could see until they got stem cells.
Oh my gosh.
That's amazing, but those things are not talked about, and nobody hears about them. And part of it is because I'm so busy doing what I'm doing, I don't have time to write up all this paperwork,
Well, stop right there, because I want to ask you, because my understanding was that you had Mexico here. I didn't know you were doing it in the United States.
Well, the world has changed considerably over the last 15, 17 years. Now we have doctors all over the place that are doing umbilical cord stem cells. Can you believe? And they're selling them. You can buy them online even. It's just amazing. And the FDA is not coming after anybody, it seems like. And the reason, I think, is because there's no harm being done. And so when there's no harm being done, and it's just a matter of the pharmaceutical industry bitching about the fact that we're not using all their drugs as much, the FDA has a hard time going up against the public when the public is saying, why not? It's not hurting me, it's my money. If I want to spend it on doing this and it doesn't work, that's my tough luck. When you come to me, I don't tell you that it works fine for anything. I say, it's all experimental. It may work, it may not. You have to sign a piece of paper that says it's all experimental, and take your chances on whether or not it's working, because all I can do is try to maximize your chances, but I can't say that it's going to work positive. You can't say that about a drug. You can't say that about surgery. Why could I say that about stem cells? But people will say that, out there. And so those kind of people that are making a lot of claims and all those people get in trouble. You can't say that stem cells are a treatment for cerebral palsy. I can say it helps stem cells. Stem cells can help cerebral palsy, but I can't say it cures it by any means. I can't say it cures anything. Okay. But it sure helps your quality of life. If you were in a wheelchair, you might be able to walk now. If you could not see now you can see. Now, is that a quality? Yeah, I think that's a quality of life issue. Is that
absolutely? That would definitely be a good. Yeah, I think so. I don't have to think too much about that.
Yeah, it's not a cure, because they may still have some paralysis or that, but it's and that's where
it's an improvement.
Yeah, the FDA gets into saying, if you're saying it really cures something, you're in trouble. Now you've now labeled it as a drug. You become an illegal purveyor of an illegal drug, and now they come after you and all that kind of thing. So I don't do that. It's all experimental that I do, and even though I've done thousands, more so than anybody else, I still say it's experimental, because I have all these legal issues that I have to deal with too.
Well, and furthermore, you don't think polemically. You're not reductionistic in your thinking. So the word cure is not in your vocabulary, because it's too reductionistic and too simplistic.
Right.
And you're a comprehensive guy. You're doing a multiplicity of things all at the same time.
Right.
Now, this is a terribly interesting conversation. I hate to take a break, but we got to take a quick break here. And I'm going to tell you the question I'm going to ask when we get back. I got two questions. They're both big, and so we're going to go over if we have to, because this is such an interesting conversation. And I know a lot of our neuroscience individuals, our core brain people, are going to be interested in these next couple of questions. When we come back, I'm going to ask you about 2 things. One is, we've been talking about stem cell. We've got the book. We're going to have the book in the show notes, this, umbilical cord stem cell therapy. We're going to have that. Then we're going to do is come back. I'm going to ask you about HBOT. What is HBOT? What do you do? How do you do it? And we're also going to talk about ALS, Lou Gehrig's disease, and Alzheimer's. And I mean, how can we do that? And another half hour. It's going to be terrific and difficult, but we'll be back, folks, in just a minute to ask David more specific questions about those two topics. Let's take a break. Well, folks, you know as well as I do that psychiatric treatment failure, especially after multiple medication trials and those very, very brief hospitalizations, may prove insufficient to deal at home with the complexity of troubled children and those adolescents from 6 to 17 years old. Improved care, those next mandatory steps, should include a more comprehensive approach to address those multiple levels of challenges, from family to peers to school, diagnostically from defiance to depression, on every level for families, including military families internationally. The Barry Robinson Center's 32-acre open college-like campus in Norfolk, Virginia, provides safety and security and clean, comfortable living. How do we know? We refer folks over there all the time, strongly endorse what they're doing. So for further information, an informed interview, connect at this page, barryrobinson.org/core. Well, you folks already know that here at Core Brain Journal, we're on a mission to introduce you to resources that make significant contributions to the investigation of those predictable mind science applications. Our colleagues at DHA Lab Group provide a real difference with treatment options for people at every level, from first awareness of mind problems to those frustrating times when even well-informed treatment becomes surprisingly unpredictable. For my entire professional life, from psychoanalysis to brain scans, I've searched for, yes, improved predictability. The good news for all of us, from professionals to patients, remarkably effective research offers useful, cost-effective, organic options far beyond guesswork with psychiatric medications alone. DHA lab tests measure unbalanced biomedical details through easily available testing, now available globally for a variety of molecular answers from, for example, methylation, copper, and cryptopyrrole challenges. Check in for more details at dhalab.com core. That's dhalab.com/core. Well, David, thanks for coming on board. This is so darn interesting. So let's just start with HBOT, and I got the curiosity cat going on here, because do you use a hard chamber? Do you use an inflatable chamber? What is your atmospheric pressure that you use? And tell us a little more. You put in pure oxygen. How do you do all that?
Well, it's basically hyperbaric oxygen has to be a pressurized system, and so you have to have some kind of a container that the person is sitting in. So there, like you say, there's hard metal shells that you enclose the patient in, and then you also have some like canvas kind of soft, and the soft ones have atmospheric pressure from 1 to about 1.3 atmospheres, and the hard shells go from 1 atmosphere up to 2 to 3, depending upon the chamber. The chambers I have go from 1 to 2 atmospheres, and the reason you can go higher if you buy a more expensive chamber, but when you go above 2, then from a neurological point of view, you start having more troubles. From a neurological point of view, you have more seizures and things like that. And so from a general practical system, mine are only designed to go to 2, and I don't go to more than 2 because of the fact that you have more complications when you're doing neurological with them, and that's what my cases are, neurological, so I had no reason. Now, if I were treating diabetic neuropathy kinds of thing, diabetic ulcers, then I would be wanting to have a chamber that would go to 3 atmospheres, because then you'd be using your pressure is at 2.3 atmospheres, but I don't treat those kind of cases much at all. In fact, I haven't treated one in many, many years, and so I have no reason to have those more powerful chambers. But the point of the way it works is that you have to have generally an area of your body where there's a lack of oxygen, a partial lack of oxygen to a tissue, generally because of some damage that has occurred. So if you were in a car accident, you banged up yourself, and the blood vessels in that area have been damaged, then the blood flow is not going to be as good. The tissue swells up, and with a combination of the edema from the damage and the blood vessels being damaged, this tissue becomes very swollen, and you will be suffering in great pain. And you might take maybe it takes a month to 2 months for you to recover from this big bruise. Let's say you were like, I remember a case, a motorcycle guy. He falls off his motorcycle at 50 miles an hour. hour and bounces down the freeway. And
Yeah.
his whole left side is just twice as big as his right side, because that left side just went bang, bang, bang down that freeway. And so his left buttock was about twice as big as his right buttock. Well, what do you do with that? So he actually was able to sit in the chamber, and within like 3 days, we dropped that right down to darn near normal. So the pressure was able to reduce that swelling and take away the inflammation and whatnot, so that the blood flow could return and the edema could leave. And he was able to get out of all that month-long of pain and suffering because he was able to do hyperbaric. Hyperbaric will actually heal you about twice as fast as you would normally without hyperbaric. So it's quite the therapy for any kind of a traumatic injury that you have. Unfortunately, people don't think about it because, first of all, you don't have traumatic injuries very often. But if you have a family member sometime, or if somebody that you know has been in a car accident or whatever, you can, remind them that hyperbaric oxygen will help them solve that problem quickly and easily. Now, in stroke, it's a different situation in the sense that the stroke causes a clot or a blood blockage to a blood vessel in the brain, and that causes the tissue in the brain to become inactivated and some of it to die. Now, with that dying tissue, that tissue swells up too, just like the buttock was swollen because of that car accident, that motorcycle accident. So that the inside of the brain swells up, and it continues to swell up for about 72 hours or so after that stroke. Now, in the first few hours is a real critical time, because during that first few hours, that swelling just keeps getting bigger and bigger, and it causes more and more pressure on the blood vessels that surround it, and that increasing pressure on those surrounding blood vessels causes those blood vessels to become occluded as well. And so you have an escalating, expanding brain problem where the tissue is gradually becoming more and more involved. And so stroke goes from a small area to a larger and larger area. And the best case that I know of to remind you about is Richard Nixon. When he had his stroke, if all of us remember, some of this older folks can remember him, and he was on his way to the hospital. He was alert and awake, and he was giving us all the victory sign. He was going to overcome and all that. Well, within 24 hours, he went into a coma and died. And the reason for that was because of this expanding this edema that was swelling and causing compression of the blood vessels around that central area that he had started off with. And so anything you can do to compress that and keep that swelling from occurring is beneficial. So I had a patient like this who came in a coma, who called me, her daughter called me in a coma. The patient had a coma. She was being admitted to the hospital. The daughter called me, "What do I do?" I said, "Put her in an ambulance and bring her over to me against medical advice." Can you believe it? And so it was a
you are a serious fortitude guy.
Yeah. So here I bring this patient over. She's in a coma. I put her in a chamber and I treat her for an hour, and she doesn't get a bit better. And I'm about to die myself, because now I figure, I'm in trouble. I'm in big trouble. So I pull out my stops and I say, okay, I'm going to do this and this and this. And so I put her on an intravenous solution of all kinds of goodies to help take away the swelling and inflammation. And I put her in hyperbaric oxygen, and within an hour she was better. And then I did it again, and she got better, and better. And within 24 hours, she walked out of my clinic intact. Swear to God, walked out intact, talking I had to hang onto her arm just a little bit, because she was a little bit unsteady, but she was alert and awake and had no paralysis. Never had to go through physical therapy. That's the power of doing a combination of hyperbaric and other things.
And the IV. Now, did you put straight oxygen in there, or just use the hyperbaric?
No, just hyperbaric was for the oxygen. The IV was a combination like chelation and mannitol and catalase and different antioxidants.
Well, I know some people use supplemental oxygen, but some people just use the straight increase in pressure to increase the oxygen perfusion. Do you run real oxygen in there?
Yeah, pure oxygen, medical grade oxygen.
You do?
Yeah, I don't believe in using air, because you need to get the oxygen in there at high pressure, because you've got damaged tissue. It needs oxygen. You need to get that oxygen to the tissue. You need to saturate the blood that's going in there, because the blood can't get in. It has to get through by serum. Okay.
Yeah.
So it's a great.
Well, then the other thing is, what were you running in there? What were you doing? Vitamin C, omega-3 fatty acids. What kind of things were you doing?
Like I was saying, the chelation was EDTA chelation.
EDTA.
Mannitol. Mannitol is I was using catalase and superoxide dismutase and things of antioxidants
I got you.
to
Yes.
help shut down the inflammation and take away the swelling. Okay,
Very
so
interesting.
now the interesting is, now I went on to chronic stroke, and I started treating chronic stroke, and I had great results with that too. And I did a whole, most of my cases were 2,000 of those were chronic strokes. People come 2-3 years after having done everything else, and they're running out of options. There's no more options at that time. There had no stem cells that were around. And so they came, and we did a 2-month program, and we got about a 93% success rate in terms of at least one or more of their different functions that were lost were able to be regained. So we had a great success compared to everything else. But then after that, they'd say, well, what else is there? And that drove me into stem cells. So looking for those people to get answers, I came up with stem cells, started using stem cells on them, and we've been doing stem cells ever since. Now our hyperbaric oxygen load is very low because stem cells have really replaced in general the use of hyperbaric.
Is that right? That is so interesting.
Yeah, because you can come in and one day I can give you the same amount of treatment in one day that in terms of results that you can get for 2 months of hyperbaric. So it makes no sense to spend all the 2 months of going from your house to the hyperbaric and back and forth and back and forth. It's a 4-hour trip to get this all done every day. And so it takes a lot of time and money. Whereas with stem cells, you can come in and one day you can be a whole bunch better. And the cost is about the same. So the cost is no, and so it's just a matter of time. And it's just amazing how much better you get with stem cells as compared to hyperbaric. Now, hyperbaric is still good for those people that can't afford it and do a few treatments or whatever. But still, all in all, I've gone mostly all to stem cells because of the better results overall.
That is totally interesting. Now, let me ask you this question. Let's go back and hit one of the main reasons we started talking, ALS and Alzheimer's. Let's talk about those pathologic states. And what do you do? Do you do the entire, as they say in Philadelphia, the whole mishpucha, or do you do just the stem cells? What do you do with those maladies?
Well, with ALS, it's very interesting. And one of the PDFs that we have for you, if you want to download it, is my understanding and explanation of the cause of amyotrophic lateral sclerosis. And now it's a little bit complicated. I'll quickly go through it, but basically it starts off, mostly men have it as compared to women. And the reason for that is because men are more active in the youth. They're more football players and soccer and whatnot. And what happens is they get their necks injured, and the neck injury causes over time a degenerative joint disease called arthritis and osteoarthritis, and they also get osteophytes, calcium deposits in and around a spinal nerve. Okay, so now that's okay, there's no problem. The person's going about their life as if nothing happened because it doesn't bother them, but they have it. And so now here, when they're 40 years of age or whatever, they now have another accident. They fall and hurt themselves, or they're in a car accident or something, and they bang their neck and they re-injure that same area where the osteoarthritis was. And that re-injury causes an opening in that, so that there's an opening that forms between the blood and the cerebrospinal fluid, just a crack. And it's enough of a crack for white blood cells to get in. Now, the white blood cells that circulate in that person at that time are poisoned. That's the key. It's the perfect storm. ALS is a perfect storm because you have to have it all these little components to get this disease. And one of the components is an infection in your body. Usually it's in the intestinal tract. Usually it's from fungus, but it can be other things. For example, Lyme disease can cause it. Helicobacter pylori can cause it. Sinus infections can cause it. Any kind of infection that allows the chronic infection that has the monocytes, which are microglia or phagocytic cells in the blood, they go around and eat up all these poisons. And whenever they can find these poisons, they start eating every day, all day long. They get completely congested with poisons. And this congested poisoning causes what is called oxidative stress in the monocyte, and that causes the SOD, the superoxide dismutase, to become folded improperly, and that forms aggregates, and these aggregates then are then placed into the cord by the monocyte, because the monocyte is attracted to that injury site. So the monocyte goes to the injury site where the break is, and the blood, cerebrospinal fluid, barrier, and the monocyte drops these aggregates of superoxide dismutase into that, and now you have them in the cord, and you have activated microglia in the cord, which surround the motor neuron, which then are killing the motor neurons. Okay, so now you have to work on all of it. First of all, heavy metals like mercury are also involved because they allow these yeast poisons and all that to take a hold of your body. And so if you have been eating a lot of fish or whatever, or lead and mercury are the two major ones that are causing or contributing to this. Now, they by themselves do not cause it generally, but there have been a few cases that have been just lead poisoning. For example, 4 cases out of South Dakota back in '85 or so, they were reported. So in another case, there's each case is a little different, so you have to evaluate each person. But in general, you want to get rid of the heavy metals. You want to try to treat the fungus and all these bugs. Like in the gut, there's not only fungus, but there's Clostridia often, E. coli, there's a bunch of things. And if they have Helicobacter pylori, you got to treat that. If you got sinus infection, you got to treat that. If they got an abscess tooth, you got to treat that. You got to treat everything that there is to treat in terms of infections. Otherwise, you're not going to be successful. You do all that, and you give stem cells to fix this cord, the cervical spine leak, and you put stem cells into the spinal cord. You get some really good results.
That is amazing. That is so darn interesting. It's really, really, really interesting. Now, let's go back and hit that PDF. Is that downloadable at your website, or where is that?
We gave it to you to download for.
Oh, the out with the bad, in with the good?
Well, it's the one on ALS. It's osteo. It says something about osteo. What is it called? It says. Where's that? Here it is. It's osseous spinal injury and re-injury in ALS. Do you have that one?
No, I don't think so. But I'm going to ask Tiffany to get it because that's so darn interesting.
You should have it there.
Yeah,
but you can look up. You can put my name up on Google and probably Google it too.
All right, good.
It's published in the Townsend newsletter, and
I did see
October of 2016.
I did see that.
And now
I do have that downloadable. That's on the last page. I asked.
Yeah. Now you can also see a lot of this on video on YouTube. If you put in Steenblock and ALS, I've got some really good videos on this whole topic as well.
Fantastic. Now let's go ahead and close with Alzheimer's a little bit. I mean, these subjects are too deep to talk about in 5 minutes, Yeah. But let's wrap a little bit if we can, because that is such a hot topic, as you said when we first started talking this evening.
Okay, well, Alzheimer's is a totally different condition. Number one, there's a lot of blood vessel damage in Alzheimer's, which nobody seems to know about. And in fact, if you look at all the cases of Alzheimer's, about 2/3 have vascular disease as a significant component. Almost one third of all Alzheimer's is due all to vascular disease. So that's atherosclerosis, hardening of the arteries. Okay. Now, one of the components of that is oxygen deficiency. Now, we talked about oxygen deficiency in stroke. In this situation, it happens to many people. Many people have oxygen deficiency. They don't know about it. But it's only at night. You and I, normal people, have a decline in our oxygen transportation at night by 10%. So during the daytime, let's say you have a 97% oxygen saturation. At night, it'll be 87. Okay, so that's how low it can go. Now, that's just the average person, but the person who's obese, who drinks alcohol, who sleeps on their back, and has drinking and is overweight, they almost always will have hypoxia at night. Now, that can cause hypertension, that causes atherosclerosis, that can cause heart attacks, all kinds of things. Not good things to have. Okay, now Alzheimer patients oftentimes have that. They have this intermittent hypoxia. The macular degeneration patients have it as well. So macular degeneration, I believe, is most oftentimes due to this lack of oxygen at night as well. Now, that's the fact that nobody out there seems to know, but I do, because I treat patients with it. I see it all the time. So if you have macular degeneration, for God's sake, ask for an oxygen test that you take while you're sleeping. Okay, it's called a nocturnal oximetry test. Hardly costs anything, and it can save your life, save your eyesight. I've had people just do that, put them on oxygen, and their eyesight comes back. I've had them come in demented and put them on oxygen, and their dementia goes away. And it's just within one day. And as soon as they stop their oxygen, they're demented again. So you have
amazing.
Yeah. So
that's amazing.
You have to understand oxygen is key. And I make a joke about God. I believe in God. That means G starts for Genesis, or get up and go, and D is for done or dead. And in between, the only thing that counts is oxygen. Oh. So that's my sum total of life.
that covers it right there.
Really.
I mean, it has a spiritual message. Really? And a very practical utilitarian message as well.
So anyway, go back to Alzheimer's. Another factor is that oxidative stress, because when you have oxygen deficiency, when you get oxygen back, you get what's called an oxygen reperfusion injury. That causes free radicals to form, and then you have free radicals in your spinal cord, and that causes an oxidation of a particular kind of protein called tau, T-A-U.
Mm-hmm. Tau,
and
yep.
tau becomes oxidized, and that starts to cause it to be hyperphosphorylated, and that hyperphosphorylated tau goes into the locus ceruleus, which is in the fourth ventricle of the brain, and there is no barrier, no blood-brain barrier between the locus ceruleus and the spinal fluid, and so the poisons in the spinal fluid then are transported into the locus ceruleus, and now you get hyperphosphorylated tau in the locus ceruleus, and then that starts the whole process, because that then has a prion-like activity which causes it to replicate over and over again, so you have more and more hyperphosphorylated tau, and then that hyperphosphorylated tau jumps from one neuron to the next, and then that's transported throughout the brain, and so that's how it all spreads. Now sugar, turns out, is another contributing factor to hyperphosphorylated tau. And so sugar intake now has been definitely related to the formation of Alzheimer's and this phosphorylated tau. So if you're concerned about having Alzheimer's, stop taking sugar. Get rid of the sugar out of your diet. It's bad for you. I know it's tough. It's cold turkey, baby. Go for it. It's good for you. Get off of sugar. It's not good for you. Stop it for a lot of reasons. It causes allergies, hypoglycemia. My daughter made a joke about it once. She says, Dad, the problem with everybody in this world, it's the bane of everybody's existence, it's adenoids. I said, adenoids? I said, honey, I've read every book there is on adenoids. I've taken them out of people surgically and all this. I've never heard of anything like that. Don't you mean adrenals? She says, oh, adenoids, adrenals, what's the difference? So we got to get it straight.
That's like I didn't do it, I wouldn't do it, and I'll never do it again. Yeah. Oh, that's wild. No, listen, what I'm really happy about is the player on our website has a slow and a pause. Okay. Because you are really loaded with information, and I can't tell you how much I appreciate you cranking it up, because you're really getting a lot of really good information out there. And what I need to do personally is come back and listen to you again, because it went by, but because you're in a language base I'm not familiar with, and all of our progress is based on effective communication, and you're doing a great job of communicating, but I got to get my listening cranked up a little bit better so I can actually digest it. But it's so terribly interesting. So your bottom line is, I wanted to ask you this question as it came up. So do you do hyperbaric with Alzheimer's?
To some degree, but let me just finish one more thing.
Please.
Sugar is bad, and the reason why more so than anything probably is because of the yeast. Yeast infection in your intestinal tract is the cause of Alzheimer's, Parkinson's, multiple sclerosis, and ALS by far, and you want to consider that anytime you have any neurological case, you've got a yeast problem, and you got to get taken care of. And I swear to God, I don't care who. Now, it's been shown by autopsy studies, 100% of all autopsy studies that have been tested and used, and when you're looking for it, they have found yeast in everybody's brain with Alzheimer's. They found yeast in everybody's spine with ALS. Okay, everybody. Mm-hmm. Okay, now that means that at autopsy, everybody's got it. Don't you think maybe they've got it in life too?
And maybe that's why they're eating the sugar. Now listen, I'm telling you this, David, you're going to get a kick out of this, because are you familiar with Biocide? Are you talking with Dr. Rachel Fresco? We interviewed her. She developed Biocide, and you know what listeners need to know. It's 097 on our corebrainjournal.com/097, and we talked about Candida very extensively on that one, and this is the first time I've really heard it in such a practical, applicable way regarding neurologic injury. We see it all the time with brain problems. We see it so many times with people who are refractory that actually on my protocols with the supplements we use over at Core Psych is we really look at Candida as like up at the top of the list and getting the liver clear so that the Candida can be cleared out when we kill it. I mean, that whole combination of things has to be done for ordinary psych, chronic psychiatric conditions that are refractory to care. Yeah.
Well, that was like my first, I couldn't believe it, myself. I first read about trust back in 1989 in the Journal of Orthomolecular Medicine. I said, this is total quackery. I mean, really. I'm a standard doctor. I said, this is total BS. It can't possibly be.
Me too.
I kept looking at it, and then he published more articles. Crook come out with some things, and I had a patient come in. She had every kind of problem you can name. She had fatigue, she had aches and pains, and she was sick as hell. Had seen 10 doctors, had been suffering for years, and I said, well, and I looked at her and said, you could have this, and somehow I decided that maybe she had yeast. I said, let me just try this antifungal stuff on you, and sure enough, within a week, she was a new person. She just couldn't sing my praises high enough. I was God Almighty because I had cured her after all these years and all this misery and suffering that she had gone through, and I'd fixed her. I mean, I can tell you one story after another after another.
Me too. Yeah. We're brothers from a different mother on this one because I had that transformational moment myself, very skeptical, quackery. It just doesn't make any sense at all. Why would a person have Candida in their yeast? I mean, Candida in their bowel and yeast in their bowel, and then what to do about it. And we're really serious about measuring everything because, hey, I'm a psychiatrist and I've got to maintain some credibility, so I got to show it to them on paper.
Sure.
And we use the Great Plains Oats, and we combine it with IgG testing because Great Plains does such a good job of getting the IgG dimension and then the arabinose whatever on the oats, and we have it hardcore. There it is, right in front of your face. And here's the protocol. Let's get it done.
Sure. Yeah, well, you can't, it's oftentimes the only thing that tells you for sure is that oats, whereas because CDSA says no growth, and I did a little bit study where I took yeast cultures and I sent them, here I have it I got it right here in my lab, in my office. I take the plates and culture them, send them off to the lab. I got a 50% take. 50% of the time it didn't grow at all. And even though I had live yeast when I sent it. So the cultures just don't work quite well to culture this stuff. So you have to go with like the urine organic acid test.
Yeah, it's very, very interesting. Well, we have very, very similar practices. You're doing a lot of things that I wouldn't begin to do just because, honestly, the politics. I was interested in HBOT back in 2003 when I started seeing brain injury doing SPECT imaging, single photon emission computed tomography, and I became aware of it. We treated several people that had dramatic changes with HBOT. But I'm in a small town, and I just said, I just couldn't handle the politics because I'm a psychiatrist, and psychiatrists have a reputation of being on the edge anyway. So then the issue is, what's this guy Parker? I mean, he's been talking about psychopharmacology. What's he doing treating yeast and HBOT and has a big chamber in his office, so.
Well, I don't know. I go back to the Journal of Biological Psychiatry in 1989. They had a paper, if you remember. Did a study with Texas. They had I think it was like 100 consecutive patients being admitted to a psych hospital, and they evaluated them, and they found that something like 50% were there because of biological reasons.
Oh yeah.
Not so the 50%. Is so you just could, all you have to do is call yourself a biological psychiatrist and go for it.
Yeah, I'm telling you. Actually, what I do is I don't like the word functional because it puts me over in a club that actually runs down traditional, and I still use psych meds. So I think of myself as a comprehensive guy, which is a biologic guy.
Yeah, talking about that. Prozac is a drug. Of course, everybody's using it, but it causes neurogenesis. It enhances neuron growth, and lithium does too. So for Alzheimer's, those two I'm using a lot because I put them a little Prozac in the morning and lithium at night because lithium stops that hyperphosphorylation of tau as well. So if you have a mildly demented person and you want to do something nice, just put them on a little Prozac and lithium.
Yeah, the only problem with Prozac, it has so many drug interactions and so on, with the 2D6 and 3A4 blockage, but I understand what you're talking about, especially the lithium. And I'm hoping to have another DO, interestingly enough, Jay Lombard with the gene site testing. I want to try to say it's Genomind, not gene site. And he's a big proponent of using lithium for serotonin transporter changes on genetic polymorphisms of serotonin transporter mechanisms. They really apparently helps out. He's done some good research on that. So
yeah, lithium is an underutilized drug, I think.
I think you're quite right. Well, listen, I could talk to you all evening, buddy. We're going to have to wind up here. It's so much fun talking to you, and we got to have you back. I mean, we'll just figure out something to talk about because it's so interesting, and you are so doggone deep, and I know a lot of our listeners would love to have you come back. So we'll think of a proposal offline, and we'll come up and we'll have another meeting somewhere down the road.
Yeah. Did you give out my phone number or anything?
Oh yes, that's let's talk about where your phone number and your website. I knew I was going to have it on the show notes, buddy, but let's go ahead and put it down. Absolutely.
My cell phone number, my phone number is 949-367-8870. 949-367-8870. My website is www.stemcellmd.org. Stemcellmd.org.
Sorry, I neglected. I got a little excited there on that. I apologize.
I know. We get excited about. We forget the standard business things.
Yeah, we gotta
let people know where we're at.
Yeah, business. So I'm going to have those listeners on the website. I'm going to spend some time on the show notes here because you want to come in and download things, and we're going to put it together. I think what's happened. What's really been very helpful here is that thank you very much, David Steenblock. You have done a great job of pulling together a lot of information in a very doggone short period of time. We really appreciate it.
Well, thank you so much for having me.
Thank you. We'll have you back. Thanks for listening to Core Brain Journal. We're working every day behind the scenes to bring you reports that connect research benches with those street trenches. Here we share the complexity of mind science because, as you know, details really do matter. One of the most pervasive, misunderstood challenges is how commonplace medications, like those written for ADHD, are used so regularly without clear guidelines. If you think you'd like more specifics, take a minute to download my 2-page PDF packed with video links and references on the absolute essentials of how to start ADHD medications. They're easily available at corebrainjournal.com/start. Thanks for listening. Do connect and stay tuned. Together we can make a difference.